Well, thank you for inviting us today. I'm Mindy Lull, and I'm here with Jennifer Mathews, and we're excited to talk to you a little bit about assessment consistency and how we try to make consistent exams here at Wegmans School of Pharmacy. Thank you all for joining the webinar today, and we hope that we can give you some good pearls to take with you. So we're talking here again about assessment consistency. Is everyone on the same page, which we think is important. And over the course of the next hour or so, we will be really breaking this down into two main areas of exam consistency or assessment consistency. The first is how we can use faculty development workshops to provide a good foundation for quality exams and consistent exam items. And Dr. Mathews will be talking to you about that. And then we'll also talk about some of the kind of nuts and bolts of the using ExamSoft for that consistency. So creating guidelines for how to create items, create exams, launch those exams, and then give exam reports at the end. So we've tried to come up with a couple reasons why we think that consistency is important, and I think that some of these are from the student perspective as well as the faculty perspective. Overall, whether it's consistency in the quality of an assessment item or in the administration of an exam, it equates to exam quality. So the more consistent two exams are, or the more consistent exams are in a course, the better quality those will be, and we always want to be delivering good quality to the students. One other important thing, whether you ask a faculty member or a student, is that we want our exams to reflect content learning, as opposed to assessing whether or not a student can take a test or take an assessment. And by having this consistency and having the items and the exams very similar in terms of how they're organized, that's going to reduce student confusion and frustration. And so the students will be tested on how well they have conceived the concepts in that course, and not could they interpret how you worded the question, or can they interpret what the intent of the question is. And we always know that students are happier when they're not confused or frustrated, and will do better overall in your course. All exams are high stakes. Even if faculty thinks that it has fewer points and it isn't that high stakes, all of our students think they're high stakes. And so if something is high stakes, we don't want extraneous things impacting their quality. We want quality questions that ask what you're trying to ask and allow the students to show that knowledge. And so if we can eliminate any confounding factors that would mask that measure of their knowledge, then we want to do that. Once the exams are done and we've graded them, we're using this data for a lot of different reasons, at the administration level, at the individual faculty level. And so we want the performance on an exam to accurately tell us whether or not the students know the material. So just like the students want that grade they get at the end to reflect what they thought they knew going into the exam, we want to be able to say with confidence that the grades that students got, or that the performance of a certain question, is only due to the content on the question itself and not due to things like an error in the question or ambiguity in a question.
So I think for us, the first stage was really, if we want everyone to be on the same page, we need to provide faculty development for that consistency. So each of us, prior to these trainings, had a way that we were doing things. Some of us were doing learning outcomes, some were not. Some courses had a couple course learning outcomes, some had many. And so really doing these faculty development workshops allowed all of us to be in a room together and to think about the process from the very beginning, starting with writing learning outcomes all the way out to, well, what are we doing with the data once we've collected it? And so each of these workshops that we held, so doing quality learning outcomes, writing exam blueprints, coding to Bloom's taxonomy, the peer review process, each of these provided a different piece for us in writing high quality exams. The additional piece to that is it also provided consistency. We had all been in the same trainings, we had heard the same information, and we were applying the same principles. And so this is really where we felt that we could lay the foundation for writing high quality exams that were truly reflective of that student learning. So if we think about the assessment cycle, really it does begin with developing clear learning outcomes. And so we spent a good deal of time thinking about what does a good learning outcome address and what does it assess. And so we have these outcomes both for the course and also for individual lectures. And we want to see that they align well together. It'll be important because we're going to take those outcomes, and those are going to really be the roadmap for students to understand if they're successful in the course. And so with those outcomes, we're then going to design different experiences. So some of it may be lecture-based, it may be cases, it could be videos, any number of different things that are going to supplement what we have said is important for them to learn in that course. And then the next step is obviously to assess them. So with these high-quality exams that are very consistent, we're getting at, did the students learn what we wanted them to learn? And if the answer to that is yes, that's great. If the answer to that is they didn't perform the way that we had hoped that they were going to, it gives us time to pause and reflect on, well, what are the reasons why they didn't? And so then you can continue this cycle of, well, was it a poorly written question? Did I not have enough time in class? Were there other factors that played into the students not performing well on that? But we're going to go through this cycle over and over again and think about, okay, we've assessed the students, now let's improve our teaching and the environment in the classroom. And then again, we're going to rethink about our outcomes addressing what we want them to, and do those experiences and assess again. So this is really, the cycle is described by Middle States on the Commission for Higher Education. So the first thing that we were going to do was think about clearly written outcomes and produce exam maps. So once we had made the decision that we were going to use ExamSoft, we kind of went all in. And so we had decided everyone was going to use ExamSoft and every course was going to test using ExamSoft. And so we really wanted everyone to be on the same page. This was a new technology for our school, and there was a lot of training that needed to be done at the front end before we really did the full implementation. So our first series of workshops were led by NABP. This gave a certain amount of credibility to the workshops because, again, this is the organization that's going to be licensing our future pharmacists. So knowing that this is the organization that was doing the PCOA exam, also doing NAPLEX, having somebody come in and speak as an expert from NABP allowed for faculty to say, okay, it's somebody who is very well versed in this, they know what they're doing, and would take that information with confidence. So as a group, we all sat with the different members of our courses, and we revised all of our course learning outcomes. Every single course in our curriculum had a revision to their outcomes. So this could have been a revision in wording, it could have been a decrease in number, but it allowed us all at that point in our curriculum to really reflect on, is this what we want students to learn from our courses? At the same time, we also did some training on techniques for writing good exam questions. So we took some sample questions, we worked as a group with NABP to work through those questions, what made this a good question, what made it a little poorer of a quality of question, and so we could work as a cohort and really start to see, okay, now I understand what I'm trying to do in each of these questions. Especially when we think about writing higher level questions. For many faculty prior to this training, writing a higher level question meant just really being more confusing. So adding in a bunch of extraneous information, adding in a lot of distractors that were unnecessary. So we needed to break out of the mindset of a higher level question doesn't necessarily mean that the students need to do more weeding through things, that you can still ask a very directed question, but have it be higher order at an application or synthesis level. The next thing that we worked on with NABP was the use of exam maps. So now we have talked a little bit about how do you write a good question. We've rewritten our course learning outcomes. The next thing is really, many of our courses are team taught. If we don't have some sort of roadmap that tells us what any given exam is supposed to look like, there is not going to be consistency. So I'll use the course that I teach in. There are many of us that teach in the systems pharmacology sequence. So this is a 5-semester sequence. And we use these exam maps to really keep track of, if there are 3 faculty teaching in a section and those 3 faculty are all going to be asking questions on an exam, we want to ensure that the quality of the questions is very high, that we know how many points each of us is supposed to have. We know what the breakdown of that exam is as far as Bloom's taxonomy. And so it really helps to keep us honest in writing our assessments. And then the last thing was proper coding to Bloom's taxonomy. I will say that I think that this has been one of the biggest struggles that we've had within the School of Pharmacy, is the notion of what is a knowledge question, what is application, and what is synthesis. We're currently only coding to those 3 levels of Bloom's taxonomy because we find that getting more granular than that, we wouldn't be able to have consistent data. So we're coding at those 3 levels, and we do a lot of practice to make sure that people are coding the right way. And the other point that I want to make is that faculty are writing and coding all of their own questions. We're not submitting to somebody to write them. We're not importing from a bank. So we're writing and coding and taking ownership for those questions. So this is an example of an exam map, and so there's a few different things that you can see on this. And again, this is something that many of us are using in our courses. So the first thing is, up in this left portion of the panel, you can see the course learning outcome. So this is one of the outcomes that we decided that we wanted for this particular course. And then the next thing that you can see is the number of lectures that I gave that were reflective of that course learning outcome. You can see the course activities that I did that were reflective in that lecture. So it was a little bit of lecturing, some turning point, a patient scenario. And then based on the amount of time that I spent on this, so it was 1 lecture, that was 3 points worth of questions for the exam. And I broke them down into, well, I knew I wanted to ask 1 application and 1 knowledge and 1 synthesis. And you could see each of the lecture learning outcomes that those questions then subsequently came from. So again, it allows me to document in one place that I then share with our course coordinator. Okay, we're targeting all of our course learning outcomes. I'm asking questions that are reflective of what I told the students needed to know for the lecture. And I'm very cognizant of the types of questions that I'm writing between multiple choice, short answer, fill in the blank, and I'm also spreading them across the different levels of Bloom's taxonomy. So as I mentioned, Bloom's taxonomy and how to write good questions are 2 things that we consistently revisit. And so during faculty meetings and retreats, we're always doing some pieces of this assessment where we're reviewing things, we're working as a team to come up with some ideas. So this could be to practice coding questions. It could be to address coding inconsistencies. So as we're looking through the bank of questions and we're having some heated discussions about, is this a knowledge, is this an application, that we're really deciphering that for ourselves as a group and what we think each of those different levels of Bloom's mean. The other thing that we can do with all of this information now is we can actually feel very confident when we start to look at longitudinal maps of our curriculum when we see that there are holes in the curriculum or that there are certain deficiencies. Because again, we're working very hard to have high quality exams. We're mapping to several different things in each of our exam questions. And so if we see a hole in the curriculum, it means more to us. So it means we really do have a deficiency here that we need to look at and we need to address. So that gets to some of Mindy's comments earlier about having confidence in the data that we're generating. We may send out email reminders. The assessment committee will send out email reminders on how to, quick tips, so things throughout the semester as we're now getting into writing our first exams, some quick tips on how to write questions. It may be followed with a quick tip on how to launch exams and then what to do with the assessment afterwards. In addition, faculty all have binders that have sample information. So for example, we'll have all the Appendix B topics that we're mapping to. We'll have all of the School of Pharmacy program outcomes and also have some verbs that are commonly used for Bloom's taxonomy. So really this binder serves as a one-stop place where if somebody has a question, we've provided resources that they can go to that binder and find some of the information they need. And so this is an example of a how-to that may have gone out. So some very simple construction of exam questions. So what should you think about when writing a true-false, when writing a fill-in-the-blank, and then also writing a multiple choice. So to give some scenarios and to tell people, you know, maybe some quick tips on how to best construct those questions. And then the next thing, which was, you know, once we had done some of that foundational stuff, we decided to take our process, what we would consider to be to the next level, which is the peer review process. So all of our questions are being peer reviewed. And I think, you know, as scientists and as clinicians, we really trust peer review. It tells us that there is a standard of quality, and really we're applying that same process and saying, shouldn't that same standard and shouldn't that same quality be applied to the exams, which are so high stakes and really can make or break a student's success in the program. So again, as academics, we place value in that process, and so our suggestion is we should also place value in writing quality exams, and peer review assessment allows us to do that. So this is a voluntary process, though I will say that most faculty at this point are turning in their questions for peer review. Some of this has a lot to do with pressure applied by students. And I'll show you in a second that there is a designation that we put on a question that has been peer reviewed, and the students know what that designation means. And they've seen that the quality of the questions, which are peer reviewed, have increased. And so they want all of their questions to be peer reviewed. Typically what we're doing is having 2 to 3 reviewers per exam. So it's not always people reviewing for content. It can be things like grammar and punctuation, clarity of the question without really getting into content knowledge. So it doesn't always have to be a content expert that's reviewing a question. And a point that I want to make is that our reviewers do not make changes to exams or to questions. We make suggestions, and we'll show you how we do that. But it is up to the faculty member or the item creator to make any of those revisions. So when we're thinking about peer reviewing, there are some very basic things that anyone could look for. Again, this doesn't have to be content specific. It doesn't have to be content heavy. It can be, is the question clear? As somebody with a Ph.D., can I read your question and understand what you're asking? Or do I not even know what the point to your question is? If I can't decipher it, how is the student going to decipher it? Are there typographical errors? Anything like that can be a distraction in reading the flow of the question, so we want to make sure that those errors are not there. Is it appropriately mapped to Bloom's taxonomy? So with 3 people looking at that question, we can have some discussion about, you know, is this really a knowledge question, or have you taken that up to the next level of application? Are the questions coded to the learning outcomes and to the course outcomes? If there is a past history on this question, how did it perform and what can we do to perhaps improve it? Is the content level appropriate? So we're asking ourselves all the time, this is a P1 class. Is that appropriate for a first-year student in the fall semester of their P1 year? Versus once they get into their P3 year in the spring semester, we would expect to see more synthesis and higher level. And so is that what we're seeing? Some other considerations, to always use positive language. So which of the following is true versus which of the following is false. To make sure it's jargon-free, which can be very difficult in the healthcare field, we often use jargon and abbreviations, but to keep the question as clear and concise as possible. Double jeopardy, so don't have questions where you have to answer the first one to get the second one. An exception to this will be in our calculations course, where any calculation error could be life-threatening, and they tend to make those questions tied together. And then we also want to be aware of the exam time. So if you have 40 essay questions on your exam, are students really realistically going to be able to answer that in 40 minutes? And so here you can see this is a peer-reviewed test item. So there are a couple different things that I want you to pay attention to. The first is up in the description of the question is PRTI, which is, again, peer-reviewed test item. When students get their exam reports back, they will see that PRTI designation. You can see that the place where we're making comments and making suggestions is in the internal comments box. So only the person who has access to this question, so only faculty will see this. Students do not see this information. Those internal comments are just suggestions, and it's up to the writer to decide whether or not they want to make them. So some problem areas that we know that we've run into a little bit, fill in the blank questions, especially if you're asking a very open-ended. Give me 2 adverse effects of this drug. If you make it open-ended with 2 blanks, students could theoretically put the same answer in both blanks. Short answer and essay questions, people putting very restrictive limits on the number of characters can be very stressful for students if they feel like they can't answer in an effective way. We have worked very hard to eliminate K-type questions, which again is reflective of what NABP is doing, though they have moved to select all that apply. So we have some different philosophies on the select all that apply, which Mindy will talk a little bit about. But we, again, want to make sure that if we use a select all that apply, that we're letting students know that we are, and we're also talking about the point values of those questions. And so what I want you to see here, this would be an exam that was given to one of our classes, and you can see that of these questions that are on the exam, all of those questions are PRTI questions, so everyone has been reviewed by multiple people. And if you look at our test bank now, we can say that we have a validated test bank. It has been peer reviewed, many questions used multiple times, so good values on those questions, and over 3,000 to date have been peer reviewed. And so now I'm going to turn it over to Mindy.
Thank you, Jen. So now that we have hopefully high quality, consistent questions, it also becomes important to make sure that how we're formatting the questions, formatting the exams, how we release it to students, that those are all consistent. Because those are the small things that on the surface may not seem like they are a big deal, but the students dwell on a lot of them, and it can really throw a student off if they get into an exam and are confused or frustrated because of inconsistencies in that formatting. So our goal here at the School of Pharmacy is to ensure that all of our exams and our exam reports have a consistent look. They're not going to be identical, obviously, and there still allows for faculty individuality in how they write their exams. But at least in general, when a student opens an exam, they know what to expect and they know what they're looking at. One thing that we do, and Jen mentioned this, is having a quick tips document, which not only has things like tips for writing good exam questions, like Jen mentioned, but also has instructions on how to use ExamSoft, especially for our newer faculty. But it also has a lot of things that we've learned from trial and error that will improve the consistency of the exams. And so what I'll talk about for the next little bit is the main areas in which we have these guidelines for consistency. So in our question formatting, in the way that we create exams and postings, the way we administer our exams, and the way that we generate and release our exam reports. So the first question that we ask is, can the student get a quick idea of the question? And so here's just a question that we have based on sleep disorders and asking about drugs treating sleep disorders. And before the student even gets to the question, they know all the pertinent information about what this question is. So our questions will start with the type of questions, so MC here for multiple choice. We use FITB for fill in the blank, or essay for essay, so the student knows what type of question this is right up front. They also know how many points it is right up front. Most of our multiple choice questions are just 1 point, but other courses use 2 or 3 points for multiple choice questions. Our fill in the blanks and our essays can vary from ½ a point to 4 or 5 points. So the student knows that right up front. As Jen mentioned, we have a couple different philosophies on select all that apply questions and partial credit. So if a question is going to offer partial credit, we put it right there so that the student knows. So now the student knows what type of question is this, how many points is it worth, and can I get partial credit before they've even read what the question is. It eases a little bit of anxiety so they know what the stakes are for this. It's also important, depending on how you use a select all that apply or a partial credit question, to be very clear. So for example, some of our courses use select all that apply with no partial credit. Some will use select all that apply with partial credit. And the students get a little frustrated with this, but when we talked as a group of faculty, we could not come up with a consensus of just doing one or the other. And we recognize there are benefits in different courses and different situations to either award partial credit or not. But we don't want the students to ever be questioning what the case is. So our students know now that if it says select all that apply partial credit, they know what to expect. They know that it will gray out once they've reached the appropriate number of responses, and they know that if they select a wrong answer, they could still get some credit for that question. We have learned from trial and error that difference between the two, so we ran into quite a few scenarios where the question said select all that apply, and the students kept waiting for it to gray out once it had reached the correct number of responses, and when it didn't gray out, they figured that all the answers must be correct, so it played with their mind a little bit. Instead of them focusing on what are the correct answers here, they just kept waiting for it to gray out and then second-guessed the fact that they thought they knew how many correct choices there were. So it's very important to not only let them know that it's a select all that apply, but let them know whether or not they're going to get partial credit for that. Another question to consider is, are the commonly used elements formatted the same way? So Jen mentioned this, our use of PRTI. So if the student gets their exam report back and one class uses peer-reviewed, one class uses peer-reviewed test item, and one uses PRTI, that can be confusing for them. So we use the same exact nomenclature for all the questions. A couple other things are things like use of bold, use of uppercase and lowercase, and other symbols. So whenever there's a select all that apply, we try and make that very obvious so that the student knows that right away and it's distinct from the rest of the text. Something for the healthcare field which can be useful is we always make sure that how we are noting the brand name versus generic name is the same. So making sure that the brand name is capitalized and we use the registered trademark symbol indicates to the student that that is the brand name, in addition to it being the appropriate way to represent the name. So if all the courses are using that same formatting those elements the same way, again, it's reducing confusion on the student's end. Another example using a fill-in-the-blank question. So you can see some of the items that I talked about already with using the type of question. So here is FITB, 1 point, and partial credit. The partial credit becomes very important with the fill-in-the-blanks, just like it does with the select all that apply, because if you have 4 blanks and it's 2 points, the students tend to panic if they think it's all or none. Other things, we use word banks a lot, but we also try and format how we give instructions to the students in a similar way. So things like only use the terms provided below, or using the terms provided below, so that we're clearly directing to the student that there is a list of words to choose from, and we're, again, putting it up front so that the student knows the instructions to the question before they get to the question. For these fill-in-the-blanks, it is helpful to, again, set them apart by putting them in bold or putting them in their own line so that the students clearly know that those are the words they're there to choose from. One other thing that we've learned a little bit from trial and error, the blanks always show up as numerical, and so if you have your different blanks as A, B, C, and D, and their answer form says 1, 2, 3, and 4, that can be a source of confusion. So it's easiest to just label, if you have a multiple part fill in the blank, that you use numbers so that it matches up with the blanks that they see on their computer screen. Another common element used is diagrams and pictures, and there are 2 different ways that those can be used. So you can attach it so it pops up in its own window, or you can just insert it in the stem of the question and it will stay within that same, not in a separate window, but stay in there in the question itself. And we have faculty that use this both ways, but try to be consistent within the same faculty member using it the same way. We have had situations where the students will be looking for a pop-up box and not realize that they just need to scroll down because there isn't going to be a pop-up box. One thing that can help out with this is, like I have up here, reference that picture. So say, in the attached diagram or in the picture below, so that they know to look for that in case it doesn't immediately pop up or they don't realize that they can scroll down.
One other thing that we have found with doing the attachments versus inline, so when you do the attachment, our students are responsible for their own computer, so they can buy whatever computer they want. They're responsible for doing updates, things like that. We have run into some scenarios where attaching PDFs has been problematic and caused several computers to crash, but we know that that is our own problem. So this is that the students aren't updating Adobe the way that they're supposed to. So we're still working through really trying to get at how do we best ensure that students are updating their Adobe so that if we do use a PDF that we don't run into any problems. So one of the things is to do this inline image, which helps to cut down on some of that, cuts down on some of the stress. In addition to that, if somebody does use a PDF, oftentimes what they'll do is just print a hard copy of that PDF just to have a few extra in the classroom in case there is some problem with that particular student's computer, because again, they are solely responsible for the updates on their own computer.
And we've suggested faculty, if they are going to use an attachment, to avoid the issue with a PDF, if at all possible, just use a JPEG, and then there's no issue with that.
And I really do want to clarify, that is not an ExamSoft issue. That is a School of Pharmacy issue with making sure that our students are updating.
We can't even get our students to keep ExamSoft updated. So that's in the question creation. So what about when the instructor or the course coordinator is creating the exam? Because we want to make sure that every exam that goes out and is posted to students is high quality. The questions, hopefully at this point, they're peer reviewed, they are great questions, and hopefully we've caught all the errors, but we don't want to ruin that all by then having an error in how we posted the exam. So things that we have faculty check for, again in that quick tips before they launch the exam, is the number of points correct? You know, we're supposed to have 40 points on this exam. If it says there's only 35, something's wrong. If faculty use question groupings, this is something that you definitely, it's worth a double check before that goes out, because the grouped questions need to be named identically for them to show up together in the exam and need to be added to the exam in the correct order. If you have two questions that are grouped, but you put the second one in first, they'll see the second one first. So it's always worth that second check to make sure that you're not going to have an issue with that on the exam. We use the override function for font and font size. Sometimes the questions are done on a Mac versus a PC, or people have their preferences set differently for different fonts and sizes. So we just override that before we launch an exam to ensure that all questions have the same size and font. The last minute check on if we say a question is partial credit, is it actually selected as partial credit in the question itself? And the things like if we're trying to move away from K-type questions, but if it's there, are the answers locked correctly? If it's A, B, B, and C, A, B, and C, we want those to be in the correct order. So you want to make sure that the question or the answers, the choices themselves are locked and aren't going to be randomized and moved around in the student's exam. And then, of course, the last two things before launching it, first is exporting a copy of the exam. This is a nice, quick, and easy way to do a double check on that spelling that you might not have noticed when you were reading the individual questions, and lets you see how the exam looks all together. And we've especially taken to previewing the exams in soft test just to make sure that there are no glitches or there are no errors that with question groupings, for example, or how an attachment or a picture looks in that exam. And so by doing all of these things, hopefully ensures that once that leaves our hands and the students are ready to download it, we won't run into any of those last-minute errors. But when we post the exam, other things to think about and things that we do pretty consistently here at the School of Pharmacy are the options that we enable. Again, here we're double checking for the number of points. One thing that I don't have on here, but checking to make sure if you don't want these scores to show up on exit, making sure those are not checked. All of our exams are secure. We randomize the sequence and we give a time limit. And then the different options there as well. And this is pretty consistent for what we use, the spell check, calculator, numbering, that missing answer reminder. Students love highlighting in the questions, and so we allow that. We allow backward navigation, cut, copy, and paste. So these are things that pretty consistently, so the student knows I'll have this ability when I go into the exam, no matter what class I'm in, I'll be able to highlight, or I'll be able to backward navigate in my exam. The nice thing is if you don't know this trick, you can go and set those preferences. So if all your exams are going to be posted the same exact way, you can go into your preferences and say, have this be my automatic. Have it be automatic that it's a secure exam lasting 55 minutes, and all these options are just automatically set for you so that you don't have to worry about going in for every exam and deciding on which options you have for the exam posting. You can also do that in your question creation so that if you're consistently using the same formats, it will automatically show up that way in ExamSoft. A couple other things to note when you're posting the exam for consistency. One of the things we, really from the beginning, that we decided to be consistent about was how long the students have to upload the exam after it's finished. So we want to, in case there are any issues with Wi-Fi connectivity, or a student thought they uploaded the exam and they didn't actually do that, we want the end of the exam to there to be at least 3 to 4 hours before the upload deadline. Now, we can always go in and change that after the fact, but we don't want the upload deadline to be 30 minutes after the exam ends, or it's just more work on our end to go open that back up. So we give enough time for any issue that might arise. We also very consistently, which I didn't show necessarily on this slide, but our internal policy is that any exam gets posted 24 hours before that exam is given, so that the students have adequate time to download that exam and be ready for the exam once it starts. We don't always make that 24-hour deadline.
And the other thing that I'm going to point out is the download end. So typically, let's say I'm giving an exam at 10 a.m., I'll give myself a buffer on that download end in case a student has trouble getting their exam launched, if they're having some computer issues. So I don't usually set the download end. If my exam is ending at 10, I don't set that for 10:05. I usually give about a 20-minute to 30-minute buffer just so that we can manage some of the initial starting the exam things that may happen.
And that's something that we have learned from trial and error as well, because you know, a lot of times the student, maybe their computer just takes a long time to start up and they haven't downloaded the exam like we wanted them to, or maybe their computer crashes before they get into the exam and we have to give them a backup computer. So again, it eliminates one step for us and one step for anxiety if we don't have to worry about that download period being closed when we get that student ready to download. We've also started pretty routinely using the remote deletion. So if a student, and back to that scenario where, say, a student has downloaded the exam, maybe they forget to bring their computer to class. That definitely happens. Or their computer is running really slowly and they can't get logged in. So we give them a backup computer. And we don't want that extra copy of that exam hanging around forever. So we can reverse download, which requires us to reach out to that student and have them do that, or we can just set the remote deletion date for some time at least equivalent to the upload deadline, so that any extra copies that are floating out there will just automatically be deleted. And that's very helpful so that we don't have to keep track of extra copies of the exam that may have been downloaded and not used. Exam administration is one of the last areas that we'll talk about. We have a nice proctor sheet, and we've talked about this a lot more we have for students that have exam accommodations, they're now being proctored outside of the School of Pharmacy. So we had to reflect on this a bit more because somebody that's not used to giving exams in our school is giving our exams. So we needed very consistent policies, or at least clear policies on how do we administer this exam. And so our pharmacology sequence uses this sheet that basically tells the proctor everything. Sometimes we have proctors from the other department or somebody that's not normally proctoring our exams, and so every piece of information about how we should administer should be on there. So the details of the exam, the password for the exam, the resume code, how long it's scheduled for, and anything else they should have been provided with. So our exams, we all have scrap paper, and we always bring one paper copy of the exam in case we should need it for some reason. We have a couple of different things that we check for. We do starting the exam. We wait to give our scrap paper out until we've given the password so that students don't do a brain dump and then enter the password. And then, we wonder why their timer hasn't timed out an hour later and realize that they waited 10 minutes to go into the exam, or passing out that scrap paper before we've given the password and somebody still has notes on their desk. So we've taken to waiting until after we've given the password to hand out that scrap paper. Our new challenge has been smart watches and making sure that those aren't there in addition to their phones. We may have made decisions about whether or not we answer questions during the exam, and any way that a faculty decides to do that is fine. It's just being consistent about that, so that there are similar expectations in every class. We have, from the very beginning, have been very consistent with our procedures completing the exam, making sure that we see their yellow screen before they leave the room, collecting their scrap paper. If they're using a school laptop, they have to clear their registration. So any proctor that's in the room knows exactly what they should do in these different scenarios, and we change and add to this list all the time as things kind of come up. But we know that whoever's in a room giving an exam will be administering it in a similar way. And then the final piece is just consistency in how we release the exam reports. So things that go in that report to the student pretty much across the board in our program should be the same information. So the students are used to seeing that information, they know what it means, and they, if they were getting different reports, they might be bugging the different faculty members saying, well, why don't you give us the title to the question, or why don't we see our own responses? It's just set and consistent. The students get the same information out of every report they get. And so for us, that means our category performance on all of the major categories, they see their score in percent and points. They see the average. They do see that question title. So going back to what Jen and I both talked about earlier, they can see that the title is, or they can see if the question is peer-reviewed. We've tried to make a little bit of consistency in how descriptive the titles are, so the student, they don't get that question back or the answers. So we hope they can glean something out of that question title so that they know if they missed a question, what the topic of that question was. We give them the answer key, so if they answered B and the correct answer was D, they know both what they answered and they know what the answer choice was, even if they don't know the text of that. They can see their essay responses. We release, if there is an essay, we release to them our comments on that essay. But they get used to seeing the exam report in a very specific format, and so they know what information they can get. They know what to expect on those as well, and it kind of closes the loop on that consistency all the way from creation of items through their reports on the data from the exams.
So really for us, and I think that what the message we're trying to send today is that a good exam and a consistent exam has a lot of different moving pieces to it. So it started with that faculty and professional development. It's writing good questions. It's following an exam creation procedure. How are we posting our exams? How are we administering them? What are students seeing in the reports? So as a School of Pharmacy, we've all created a consensus around what do each of these steps look like, and we really try to follow that. So I do want to make clear that that doesn't mean that there's a dictatorship. We've talked about each of these different pieces, and a good example of that is the select auto-apply, and there are a couple different ways that you can do that, which really addresses the faculty need in how they want to launch their own and create their own exams. So that training is required. We have to keep up to date. We have to keep working together. We have to keep talking about it. So we continually do this training, as I said, in our different retreats and our different meetings, so that it's always fresh on our mind that this is of the utmost importance. We want these high-quality, consistent exams, so we're really addressing student knowledge and not student ability to do mental gymnastics on any given assessment. And creating these quick tip guides really kind of puts everyone on the same page. So these little cheat sheets that we send out to faculty and we make available to them, often on very bright paper, we print it so that they can just hang it in their office, and it's a really easy way to reflect back on, what are some of the things I should be thinking about as I create these exams. And the more you do it, the more it starts to become routine, but we want to stay up to date, especially for our new faculty. And so with that, we want to thank you for your time in joining us today to talk about exam and assessment consistency and some of the things that we do here in the Wegmans School of Pharmacy, and hope that you found it useful, and we're happy to answer any questions.
Thank you so much. That was a wonderful webinar. We have quite a few questions coming in, so I'm going to go ahead and get started with that. Our first question asks, in using only 3 levels of Bloom's taxonomy, how do you address levels that are not used? For example, comprehension.
Well, some of the mid-levels, again, could float between application or synthesis. And really the reason we're using 3 is because we couldn't get to the granular nature of using all of the levels of Bloom's taxonomy. So we do our best to address some of those in-between things and whether or not they're application or synthesis, and really try to get at the major points of the question and what we're trying to get students to learn.
Excellent.
So, really for us, that was the consistency part, was that we could only do 3 levels.
Excellent. Our next question is someone wanting to know if it would be all right if they used some of the tips and tricks from your guide, specifically such as the proctor instructions, to share with their own faculty.
Sure. We're happy to share any of those resources. We can, you can take them from the slides, or if you wanted to send either of us an email, we can provide the Word documents.
Excellent. And just as a reminder, the webinar was recorded and you will have access to this information in a couple of days. We'll send an email out giving you access to the link to the webinar, and you can share that way as well. Our next question asks, as a key administrator, can I enable this somewhere in the global setting so that the faculty can just log in and see how you update exam options to enable in my preferences on the individual level?
So I'm thinking that the question is asking whether or not the key administrator could do things like on the exam report, what students see, I think is what the question is asking. So if they could just make a universal setting. And to be perfectly honest, I don't know the answer to that. I would bounce that back to you over there at ExamSoft on whether or not those types of preferences can be set by the key administrator.
Okay, great. Thank you. I would encourage you to contact our support team and see how they can get you to set up key administrator access for setting up those global settings. So you could just shoot an email to support@examsoft.com and we can get that question answered for you.
But certainly, if all of the faculty could agree on that, and that was a functionality in the key administrator's rights, that would be great.
Excellent, excellent. And just one final question. Does the peer review process frequency depend on the individual faculty member that creates the exam, or do you all have definite, concrete peer review sessions that you use throughout the semester?
Some of the different classes will tackle it in different ways. So, for example, in our pharmacology sequence, we automatically will have our exams ready for peer review 2 to 3 days before the exam has to be launched. And automatically, the other instructors in that team taught course are identified as the ones who do the peer review for that exam. So it is other people that are from the same general areas of expertise. They're all pharmacologists, and they'll review that. So that's how we have it set up in that course. Other courses have the coordinator just automatically reviews everything. We've had our department chair as part of that process. We've had our assessment dean as part of that process. So it does vary a little bit. Generally, we're creating those questions specifically for exams. And so we don't have, I mean, it would be great to have a, let's all write our exam questions and we'll peer review them over the summer. But in actuality, that would not be probably possible. But I think also that one thing to note is that once a question is peer reviewed, it's peer reviewed. If we use it multiple times, Usually the other instructors will look at it quickly just to make sure there wasn't something that we didn't catch the first time. But once you start to get this large number of peer-reviewed test items in your bank, the burden of work becomes much lower, because while we're writing some new questions every year, the first couple years that we did this, faculty that were peer reviewing had to review the entire exam worth of content. Now, for the most part, we might have 25% of the exam might be brand new and have to be thoroughly peer reviewed, and the rest of the questions we might just glance at quickly.
The one thing that I will add to that is, so even questions that have the PRTI designation, I do still take a little bit of time, just as Mindy mentioned, to go back and look at those questions, because remember, this is a voluntary process and the faculty doesn't have to take my suggestions. So if I go into a series of questions and I see that some of the comments and suggestions weren't taken, one of the things I am looking at is the performance history, just to make sure that something that I thought may be an area of concern didn't affect the student performance. And if that exam history looks okay, I may just, I'm just going to drop it and move on. If it was a poor performing question, I may re-raise my question again and say, maybe one of the things you want to consider based on the performance history is to go back and look at some of these suggestions.
Fabulous. Thank you both again for this wonderful webinar. That's our time. Once this webinar has been completed, remember that a survey will pop up for you all to fill out. We'd really appreciate if you took the time to fill out that survey so that we can continue to produce relevant content on our webinars for you all for the remainder of the year. Also, be on the lookout in your inboxes for a link to this webinar in the coming days. Thank you so much and have a great afternoon.
Thank you.
Thank you.